How can I reduce my HPV transmission risk? Imagine taking steps today that can protect your health for years to come. Human papillomavirus, or HPV, is one of the most common sexually transmitted infections, and it can lead to serious health issues like cervical, testicular, and other reproductive cancers. So, how can you lower your chances of catching or spreading HPV? Let's explore some proven strategies. First and foremost, getting vaccinated against HPV is highly effective. The vaccines protect against the most common high-risk HPV types linked to cervical and other reproductive cancers, as well as genital warts. The Centers for Disease Control and Prevention recommends vaccination starting at ages 11 or 12, but it can be given as early as age 9. For those who missed the vaccine earlier, catch-up doses are advised up to age 26. Even some adults aged 27 to 45 can consider vaccination after discussing with their healthcare provider. Vaccination is best before any sexual activity, but it can still provide benefits afterward. Using condoms consistently and correctly is another key step. Condoms act as a barrier that reduces the risk of HPV transmission during vaginal, anal, and oral sex. However, since HPV can infect areas not covered by condoms, they do not eliminate the risk entirely. Still, regular condom use significantly lowers the chance of acquiring HPV and developing related health problems like cervical cancer and genital warts. Limiting the number of sexual partners can also help. Fewer partners mean fewer opportunities for exposure. But remember, even someone with only one partner can still get HPV if their partner has been exposed previously. So, choosing partners carefully and having open conversations about sexual health is important. Engaging in mutual monogamy with a partner who has been tested and is free of HPV reduces risk further. If either partner has visible warts or lesions, avoiding sexual contact during outbreaks can help prevent transmission. Some studies suggest that male circumcision may lower the risk of acquiring HPV, which can indirectly reduce transmission. While not a guarantee, it's an additional measure some consider. Regular screening is vital, especially for women. Pap tests and HPV tests can detect early changes in cervical cells, allowing for prompt treatment before cancer develops. Though there is no routine screening for testicular cancer, being aware of symptoms and seeking medical advice if something feels unusual is important. Lastly, abstinence from sexual activity is the only sure way to prevent HPV infection. While it may not be practical for everyone, understanding that it provides complete protection is key. Remember, HPV is linked not only to cervical cancer but also to other reproductive and head and neck cancers. Persistent high-risk HPV infections can lead to precancerous changes, but vaccination and preventive behaviors greatly reduce these risks. If you are immunocompromised or living with conditions like HIV, your risk may be higher, making these strategies even more crucial. In summary, combining vaccination, barrier protection, limiting sexual partners, practicing mutual monogamy, regular health screenings, and informed sexual choices can significantly lower your risk of HPV transmission. Always consult healthcare professionals for personalized advice and follow trusted medical guidelines. Protecting your health starts with informed decisions today.